In this video, we will study the external view of the skull. Here we see the anterior view of the skull, and here the posterior view. We will also look at a lateral view. In context, the axial skeleton is comprised of the skull, the vertebral column, and the thoracic cage made up of the ribs and sternum. Here on our skeleton we see the skull, and we can see the three parts of the sternum. Here is a lateral view of the skull, and from this view you can still see the bones we covered in the last video: the frontal bone, parietal bone, temporal bone, occipital bone, and zygomatic bone. Also, here is the mandible and the maxilla. Other parts that we did not go over in the last video are the mandibular fossa, a fossa meaning a depression, so this is part of the temporal bone where the mandible fits. And there's a rounded portion of the mandible called the mandibular condyle that fits into this mandibular fossa. The next marking I want you to know is the styloid process and the mastoid process. Both of these serve as projections of the bone for muscle attachment. The coronoid process is also a place where muscles attach to the mandible. Here is the zygomatic arch. The posterior view of the skull shows the occipital bone and the external occipital protuberance. In the Greek alphabet, lambda is an upside-down V. This is the lambdoid suture. Here is the sagittal suture. It connects the two parietal bones. Using a real skull, we can see the lambdoid suture and the sagittal suture. Here is the anterior view of the skull. We see the frontal bone, and we can see nasal bones, the maxilla, and the mandible. On the medial side of the orbit, you can also see lacrimal bones. Here is the picture of the anterior view of the skull in your lab manual. So some other parts I can point out to you are the nasal bones. Here you can see where the sphenoid bone is, because that's pink, and the superior orbital fissure, the inferior orbital fissure, and the optic canal. I went over them in the last video. You can also see the inferior nasal concha, which is a scrolled bone within your nose, and the middle nasal concha. There's also one more superior in the nasal cavity. Here is the perpendicular plate of the ethmoid bone, and this bone is the vomer. Both of those form the nasal septum. Looking back at the actual skull, you can see the inferior nasal concha here on both sides, and the middle nasal concha here and also here. A little closer, this shows the inferior nasal concha, and then here is the middle nasal concha. Here is another view of the inferior nasal concha. The skull is comprised of the cranial bones, which surround the brain, and the facial bones, where muscles of facial expression. Looking at the lateral side of the skull again, we can see the temporal bone here, and here is that zygomatic arch. Here is the mastoid process I showed you before, and the styloid process, both of those part of the temporal bone. This is an inferior view of the skull. Here is the foramen magnum, where the spinal cord and the brain meet. We can see from the undersurface the sphenoid bone and part of the vomer. But I want to draw your attention to the hard palate, and this is part of the maxilla and the top teeth. You can also see the mandible here, which is still in place. You can also see the mandible connected to the temporal bone. Here's a superior view of the skull. And again, we see that coronal suture and the sagittal suture and part of the lambdoid. So this is the frontal bone, the two parietal bones, and the occipital bone. Lambdoid should have a D after the B. In this view, we can see the bones of the cranium and the facial bones, but I want to draw your attention to the squamous suture you see here, and that's the suture that attaches the temporal bone to the parietal bone. On this skull from the side, you can see the squamosal suture, and remember, squamous means flat. This is the flat part of the temporal bone. So far, we've looked at the external view of the skull. In the next video, I'm going to show you the superior view and the inferior view of the skull so you can see more markings.